everyone. My name is Caitlin Brower, Sterling Social Media Manager, and welcome to another episode of Sterling Live. A little bit different this week because I'm joined by three people, not just one, but we have a great panel here. So just a reminder that every Tuesday at 1 p.m. Eastern, we do go live across LinkedIn, Facebook, and YouTube. So happy to have you guys here with us again this week. So like I just said, I have three amazing panelists with me. I'm joined today by Peter Lehmann, our Chief Strategy Officer, Angela Preston, Senior Vice President and Counsel, Corporate Ethics and Compliance, and Joy Henry, General Manager, Financial and Business Services. So thank you guys so much for joining me today. I would love our audience just to get to know the three of you a little bit more. So why don't you go ahead and introduce yourselves. Angela, can you kick us off?
Sure. Hi. Good to see you guys. I'm Angela Preston, and as Caitlin mentioned, I'm head of compliance at Sterling. I've been with Sterling for 5 years now, and prior to that, I've spent another 15 years with legal and compliance in the background screening field, and that includes a broad spectrum of laws, including employment law pertaining to hiring and Fair Credit Reporting Act and compliance around EEOC and other regulations pertaining to the hiring and background screening process. So that's a little bit about my background, and happy to be here today to chat with all of you.
Thank you, Angela. Peter, can you go ahead and introduce yourself?
Sure, Caitlin. Thank you. So Peter Lehmann, Chief Strategy Officer for Sterling. Been with the company about a year and a half. I have responsibility for corporate strategy and for our M&A corporate development efforts. And during the pandemic, I've had the privilege of working with this team on the call here, as well as others in leading our COVID testing program.
Thank you. And last but not least, Joy, can you please go ahead and introduce yourself?
Happy to. Hi, everyone. I'm Joy Henry. I'm the General Manager for the Financial and Business Services here at Sterling. I've been with the company for almost 7 years, looking after predominantly our regulated client space. So know all too well the paperwork and regulations that we're all working through as we try to navigate this.
Thank you. Honestly, thank you guys so much. Again, you guys, everyone watching right now is in for a real treat. This is a great panel that we have here right now. So today, we are actually going to be discussing a recap of a live Q&A and panel discussion that we had last week. It was called Return to the Workplace and School COVID-19 Health Testing. So I was able to tune in live last week, and I thought it was absolutely amazing. The three of you guys did a great job. So we're going to go through just, kind of like the key takeaways of that discussion last week. And for everyone that's listening right now, I'm going to ask the panel a couple of questions. If you have any questions for the panel that I have not asked, feel free to go ahead and comment across Facebook, LinkedIn, and YouTube. We'll get those questions answered for you. But yeah, so let's go ahead and get into it. So we started the discussion last week with 2 poll questions for our audience. And I thought they were very interesting questions. And I also thought too that the results were pretty interesting as well. So I want to recap those polls, the results, and get your perspectives on what we learned last week from our audience. So the 2 questions were, what is your organization's attitude toward remote work? And the second question was, which of the following best represents your organization's current approach to return to workplace and COVID-19 health testing? So for the first poll question, what is your organization's attitude towards remote work? Our audience that tuned in live last week told us this. So 11% said employees must work on site due to business requirements. 20% had a strong preference for employees to be on site. 51%, so the majority of our audience was adopting a hybrid model with a mix of on-site and remote. And then finally, 18% or most or all employees will work remotely in the future. So let's go ahead and discuss this first poll and the responses there. So Peter, can you take it away and give us your thoughts on that?
Yeah, so what's interesting I found in that is that, you've got about 70% of the poll respondents who, are bringing some people back to the office.
Mhm.
And I think that was the numbers. I don't have it in front of me there, but I think that really tees up the challenge that employers face in making that decision. So, first question that raises is, who do I bring back? And then the next question, which I think is really what we're going to talk about here, is how do I bring them back safely? What kind of protocols do I need to put in place? And what we're hearing from our clients is that they're looking at a mix of things. And I think this is sort of the next point that you're going to get into, things like temperature checks, health questionnaires, et cetera. But for a lot of employers that we're talking about, they're looking to do more than that. And I think that's really where the question of should I be testing and how do I test and who do I test comes into play.
Joy, what are your initial thoughts on the poll responses?
I agree. I think that most organizations and in the conversations that my team and other teams are having with clients as they try and figure this out is that the vast majority of them do believe that there is some percentage of the employees that do better, perform better, are required to, for regulations, be in an office. And, but the percentage, I think, exponentially drops off when you start talking to clients who actually have a plan. And so that's really the pivoting point here is they know they want to do it. In some cases, they have to do it. It's really the how and the who that's keeping them up at night.
Angela?
Yeah, I don't have a lot to add. I think some clients don't have a choice. They have essential functions that they have to be in a workplace, whether it be an office environment or some other type of environment. And I think it'll be interesting to see over time the movement within that group where it's not essential. And but we're not there yet. But that's going to be the interesting kind of metric to watch is, in organizations where you do have an option of work from home or be in an office, where's the movement there long term until we get to a vaccine.
So our second poll question that we had for our audience last week was, which of the following best represents your organization's current approach to return to workplace and COVID-19 health testing? So we had 3 different responses here. So 38% said no COVID-19 related screening program is in place right now. 40%, the majority of our audience last week, said baseline and initial return to work screening programs only. And then finally, 21% said baseline and recurring screening programs. That's what they have as their current approach right now. So again, just walking through the three of you, your initial thoughts here. And Angela, you can kick us off on this one.
Yeah, I think it's really what are people planning to do? It's getting that plan in place that's hard. And from my perspective, hopefully we'll jump into some of the legal issues that came up in the conversation, but pretty much what we expected to see in terms of numbers right now.
And Joy, we'll get into more so like the types of testing and everything, but just, initial reaction to the numbers there of, how people are approaching this.
Yeah, I mean, it doesn't surprise me based on the conversations that we're having. I think as things continue to evolve, we go into cooler temperatures, flu season, I wouldn't be surprised if these statistics start to shift a little bit. Even listening to an interview that Dr. Fauci was doing yesterday, there are organizations that are going to be successful through this are going to stay fluid and modify and change as the circumstances change.
Right. Peter, any final thoughts on this poll question?
Yeah, I think that Joy really hit the point here that, even employers that are, whether those be workplaces, schools, et cetera, that are doing testing, I think are finding that they need to continually flex because, they're learning new things. We're all learning new things. They're dealing with outbreaks and figuring out how to continue to operate in an environment where sort of the unpredictable is the norm. I think is what companies that are sort of leading on this are figuring out.
Yeah, that's great. And again, these poll questions were very interesting to start off our chat last week. So moving into, diving into COVID-19 health testing strategies and just a little bit more detail here. So an overview of the testing. Joy, I have a couple of questions for you. So what are some of the COVID-19 testing options? And then, what are we seeing as Sterling, whether they're clients or just other organizations that we're, trying to understand, what types of options are they leaning towards?
Sure. So, I mean, at its highest or most general term, most organizations are leading with some type of PCR test, which tests for active virus. There are other options and testing solutions out there. For example, you can test for antibodies, but I won't steal Angela's EEOC thunder there. But there's reasons why we wouldn't necessarily want to lead with that. And there are also supplemental types of services like health checks and daily attestations. But the vast majority of organizations are doing some combination of temperature checks, attestations, and then at a minimum, a baseline PCR test. The types of tests specifically, there's a saliva-based test, which a lot of organizations are leaning towards. And then there's also, obviously, the nasal test. There's two types of nasal tests. And the one that can be self-administered and feels the least invasive is at the front of the nose or the anterior of the nose. Again, like I said, most of our clients are leaning towards that saliva-based test. It's less invasive. It's very similar to a Ancestry.com type of test, so it feels familiar to individuals and is a bit more comfortable to administer at home, which kind of leads me to the second point, which is that employers are looking for testing options that enable flexibility, whether or not that person is in the office, whether that person is traveling or is working remotely. Figuring out a solution that's scalable and can sort of go with the employee wherever they may be.
Yeah, so I like the point of bringing up like flexibility and like trying to understand, what's going to work best for organizations is as we look at the different types of testing options, it's that question of at home versus on-site. So Peter, a question for you here in regards to the at home and on-site testing. What are the considerations for both of them? And then are we seeing organizations, lean a little bit more towards one or the other?
Yeah, so there are benefits and constraints associated with both of those. So on the at-home side, as it sounds, the way that test would work is that the employer, it's really designed to be sort of the minimal effort on the part of the employer. So the employer would tell us who needs to be tested, and then from there, we do most of the work. So the kit gets shipped to the individual employee, either at home or wherever location they're at. The employee then does the sampling themselves using the type of saliva-based test that Joy talked about, ships the kit back, the kit gets tested, and then the results get presented both to the employer and the employee. So it's very simple, it's flexible. It allows for testing in a lot of different situations, whether that's for remote employees, for employees who may be symptomatic, or employees where there might be potential contact, where you don't want them in the workplace, or just in general, you don't want to be doing testing in the workplace. And we hear this from a number of employers. So that's sort of the considerations on the at-home side. On the on-site, I think for employers where they have a large number of employees to be tested, that could be for initial testing at reentry. It could be for rescreening on a regular basis, which employees are clients in the manufacturing, distribution, energy, those sort of spaces. That sort of periodic retesting of a large number of people is more common. So on-site works quite well for them. It's a bit more economic for the client. It gives them a lot of flexibility because they have kits there right on site to be able to use them as they need them. So I think really, Caitlin, comes down to a question of what's the population of employees that you're looking to test? What are the use cases that you're looking to do testing for? And then which of those different tests or combination of those different tests works best for each employer?
Yeah, so I like that you ended on like asking those questions. So, and Sterling does a great job with providing, best practice guidance for our clients, prospects, things like that. So are there any other questions that are best practices that we are, giving our clients right now when it comes to, the at-home, on-site, anything like that?
Yeah, I mean, I think exactly as you said, we always start with a couple of things. First of all, what are they doing today? So to that opening question, the poll question, that's always where we start, which is, what are you doing? Who's in the workplace? Who are you thinking about bringing into the workplace? Over what time period? So what's the objectives of the employer? What kind of health programs do they have in place today? Because typically we look at testing as supplementing what they're doing already, whether that's through different schedules of employees to minimize the number of people in the office at any one time, whether it's PPE, whatever programs they have in place. Testing really kind of fits on top of that. So starting with that baseline, and then really understanding the populations, where the people are, both from a physical standpoint as well as from a scheduling standpoint, and how to make the testing process both meet the employer's needs, but importantly, make it as convenient as possible for the employee. We don't want testing to be a burden. We want it to be something that fits as much as possible into their schedule.
That's great. So these companies, they're interested in implementing these testing programs. Some of them want to get their people back to the office. But most importantly, if we're reopening, people want to stay open as well, and they want to remain compliant. So Angela, when it comes to, returning to the workplace, what is, the role of EEOC when it comes to that? And I know you did join me a couple of weeks back on one of the episodes of Sterling Live, and we really dove into this topic, but I think it's something super beneficial to continue talking about. So would love for you to dive into that again for us.
Sure. So I think that, as employers are planning and whether they've been open throughout the pandemic or reopening, they need to take into account what can they do legally. So it's not just what's right for my organization or what test do I go with. It's really what am I allowed to do legally. And the EEO laws are one area of consideration for that. And employers are grappling with not only EEO laws but also the CDC guidelines, and your state and local executive orders, your emergency orders that are in place. So they have a lot to consider a big picture wise in terms of what they can and can't do. And just to drill down into it a little bit, the EEOC it exists to ensure that there is not discrimination in the workplace. So they are there to enforce the anti-discrimination laws. And one of the big questions is, can we have a testing program for COVID-19 and not come into conflict with EEO laws? And the answer is yes. And the EEOC has published guidance on this and has explicitly said that while the EEO laws still apply during the pandemic, there's no reason that you can't still act and take measures to protect your workforce and not be in conflict and still follow CDC guidance and your executive orders. So, what the EEOC has evaluated it and said, because it is a deadly virus and because it does pose a direct threat to the workplace, that you can take measures to test, doing things like asking about symptoms, taking temperature checks, having questionnaires, inquiring about contact, as well as actually administering tests as a way of determining who is safe to enter the workplace. So the EEOC has published updated guidance, and as recently as in September, they continue to add to that guidance and supplement it with specific questions. It's very helpful to go to the website and, of course, seek advice of your own counsel in terms of determining what protocols and how the interplay of those anti-discrimination laws work within the context of your program. But the EEOC has been very clear that because of the direct threat of harm to the workplace, that you can test, and you can use testing as a measure of not only returning employees, but also in new hires. Before you have a new hire start, to require them to have negative tests in order to gain access. So that in itself is not a violation of any anti-discrimination laws. Now, Joy did allude to earlier the point about antibodies and antibody tests. Because we don't really know the impact of antibodies and whether or not they confer immunity, the CDC has said that antibody testing should not be used as a threshold of whether or not someone can enter a workplace, and the EEOC has echoed that in their guidance and said, just as the CDC has said, we don't really know the impact of antibodies right now. The guidance from the EEOC is that antibody testing may not be used as a determination of employment. So that's just at a high level some of the considerations, I think, in terms of looking at this from a legal perspective.
Yeah, and I think it was a great view into things. And, one of the last things you went into, though, was the antibody testing, and that, it not being able, to be used to make, certain decisions like that. So how are companies then using this? And Peter, this is a question for you, I think. So when it comes to the antibody testing, how would an organization use that type of test then?
Yeah, look, I think this is an evolving picture. I think today, as Joy said in the very beginning, most companies are really focused on detection of active virus and are really focused on PCR testing. We do have a handful of clients that are either doing or looking at antibody testing. But to Angela's point, it really has to be done. And I'm not going to try to play Angela's role, but I'll try to emphasize what she said, is that it's got to be done in a compliant way. Yeah. You will correct me, I know. But there are a handful of clients that are looking at this more as an employee benefit. So what that would look like is, not a screening tool, not a health-related tool, but really a benefit for companies, particularly, I would say, office environment, financial services. We see this where companies are leaving up to the discretion of the employee whether to come back to the office or not. Offering this as something to help the employee make their own best decision around whether to be remote or to be office-based. It has to be done in such a way that that the results can't be used in any kind of return to workplace decision. And that's why we have Angela here to help guide both us and our clients in this endeavor. But I would say at this point, that's where we do see it used. That's how we're seeing it today. As with everything, I would expect all of this, to change in the future as things like antibody testing becomes a bit more, I would say, accurate, perhaps. But for where it is today, where we do see it, which is not in many cases, it would be in this employee benefit space.
Oh, that's great. Yeah, Angela.
No, I think it's important to look at, the big picture of a program, and antibody testing comes up in that context. But just in terms of, testing being one facet of a program, and really looking, as Peter mentioned, this is a rapidly changing environment. There's new information, and we're learning more about the virus every day. And so it is a bit of an evolving picture. That's why I encourage everyone to consult the guidance frequently and make sure that you're keeping up with the most current information, and whether that's through us or directly going to the websites and tracking and following that information. But it's a holistic picture, and the testing is one facet of many other steps that you can take to try to keep your workplace safe.
No, that's great advice. And yeah, like you said, whether it's from Sterling or somewhere else, we do have our compliance update section on sterlingcheck.com, which is, frequently updated, and we are providing guidance. So at any time, feel free to visit that. So going back into, the types of testing and looking at programs and things like that, another popular area, being discussed right now is retesting employees. So Joy, I wanted to ask you a couple of questions. So how are organizations handling this continuous testing, this retesting of employees? What types of industries are you seeing retest the most? And then finally, and this can all be answered at once probably, the cadence of retesting. So how often are employers retesting their employees? Yeah.
Sure. And this kind of goes back to what Angela just shared, that the testing is a part of an overall program, and part of that overall strategy is really breaking down your employee base into role-based testing. And so there's sort of two streams that you should think about when you're thinking about retesting. The first is there's asymptomatic testing. So no one has any symptoms. We're just looking to get people safely in the door and keep them safe. And then there's symptomatic. So someone's at the office and doesn't feel well. And so what type of retesting should be wrapped around that type of employee base. But then there's also that employee type. So are there employees within the organization that have high touch with high numbers of people, like security guards, food service, janitorial services, housekeeping, those types of roles where they're moving throughout the building, throughout the floors. And so there's a higher probability that they have been exposed or could expose more people to it. Those types of roles tend to be in a more frequent retesting cadence. So, think weekly is what most people are leaning towards. I also think that the type of test that you're using also matters. So looking at the specificity of those tests, making sure that you're using FDA EAU type of tests to make sure that you're using or getting reliable results is important. But typically those employees, it's recommended that they test weekly. We do have some clients that are also implementing sort of random or surveillance-like testing, where a certain percentage of their population that is back in the office is out, and the employees acknowledge that this is part of returning to work. So from a compliant perspective, there is acknowledgement and authorization to do so, but a random 10% of their population will be tested at any given time, just to make sure that everyone is healthy. So there is different retesting approaches. It takes a little bit of work to figure out how much exposure those different roles within the organization are, or that they have. And then the last piece that kind of feeds into retesting is the physical space that people are in. So do you have the ability to do proper social distancing? And do you have the right protocol and materials like masks and sanitizing, those types of things? Do you have those capabilities within your work environment? That should also influence your retesting frequency or cadence. From an industry perspective, so I'm trying to cover all of the questions that were included in that.
A lot. It's okay.
But the types of organizations that are doing retesting, it's pretty consistent, I would say. So we're seeing that in the financial services space, certainly where they're trying to get their revenue producers or for compliant reasons, particular roles back into the office. And we're also seeing that in schools and education, where we want to make sure, again, people are moving around and have high exposure. We're also seeing it in manufacturing and line work as well, where they're working in close proximity and it's more difficult to keep people separated in order to do their job. So it is pretty widespread across different industries. And so it's much more role-based and much more exposure-based.
No, that's great. Thank you. So I do have one final question, and I'm going to gear it towards Peter, but anyone else feel free to chime in. So another popular area when it comes to returning to work, health testing, things like that, is the role of rapid testing. So curious, get your thoughts, on the role of rapid testing. I'm definitely interested in it because I'm a huge sports fan. So we're seeing that in the sports world, those quick turnaround times there. So the role of it, but then also how are we seeing that type of test evolve currently?
Yeah, we get this question a lot from clients. It's obviously very timely in the news. So a couple of things that I would say on that. First of all, I think it's important to understand what rapid testing is really designed for. So from a FDA authorization perspective, and Joy talked about, all of the testing that we do is under EUA. Those tests, and there's a couple of different manufacturers of them now, but those tests have all been approved on the basis of testing symptomatic employees within a defined time period, generally within the first 7, sometimes 10 days. So that was what they were really designed for. Now we're seeing them sort of being stretched to using them for some organizations, using them on more of a screening basis, the kind of thing that the Joy's talked about. And I think at this point, it's really an open question what the efficacy of those tests used in that capacity are. We know that, the big advantage of them, as you said, they're rapid testing, generally 15 minutes or less. And so they can be done sort of on site, on the spot. They are quite inexpensive relative to PCR testing. The flip side of it is they do have lower accuracy. And so, they are used today. You mentioned sports. That's, where they are used in a very, very regular testing environment, i.e. like every day. I think they have found a good niche in that environment. I think it's an open question around how they will be best used in a workplace setting. It's something we are very focused on. I think we don't yet have rapid testing in our mix of services. It's something that I will expect we will do as some of those questions get answered as far as how employers use them best. But I think as part of a comprehensive program, including all of the health screening that we talked about, including more traditional PCR testing, it has a important niche to fill in there. And as I said, just needs a little bit more definition around where it most appropriately fits.
That's great. So at this time, I am looking across our platforms and it doesn't seem like we have any additional questions. But if anyone is watching and you do have any additional questions for our panel, definitely let me know. But I do want to just move into some final thoughts from the three of you, in regards to return to the workplace, school, COVID-19 health testing. So Angela, can you kick us off with some final thoughts from today's discussion?
Sure. From a legal perspective, I think you want to be familiar with whatever are the most current guidelines in dealing with your testing program, and be flexible with your employees. Understand that you have different populations with different needs, and they may be impacted by different anti-discrimination laws differently depending on their particular health condition or whatever might be going on with them. So we always encourage employers to be flexible with the employees. Keep in mind that you may need to take into account certain factors to make accommodations for certain classes of employees. So keep all of that in mind. Make sure that you're getting good legal advice, taking care of record keeping and treating everything as protected medical information. And as you're going through this, understand that there are lots of resources out there to help you and provide good common sense guidance, as well as where you need to go for more depth.
Joy, final thoughts?
I think I would just reiterate or emphasize the need to be flexible and to really be thoughtful about the way that that you're communicating with your employees. So this is a very chaotic time in general. We're all working from home, and some of us are also helping our children get through school and maintaining some semblance of normal. And so these types of tests, you know, they offer a level of security, but also instill some concern and anxiety in people. And so I think the communication around this, the reasons why, how the company's going to work with the employee and make sure that they're healthy and safe is something that a lot of employers are doing a really good job at right now. And you know, it's really driving employee engagement and frankly instilling a lot of motivation in employees. And so I'd encourage people to be flexible. I'd encourage people to continuously look at their programs and to be good communicators throughout this, because through all of this craziness, there's some really good things that can come out of it, like really high employee engagement and great ideas. So make sure you're listening and talking.
Absolutely. And Peter, finally, can you close us out with your final thoughts?
I'll try to bring it home. So, you know, Angela and Joy have done a great job summarizing. I'll try to just add a couple of sentences on that. I think you've heard a lot in this broadcast about the complexity of this kind of program, and it is complex. The good news is, you know, with time, I think there are some very clear best practices being established by companies across different sectors, across different workplace settings, across different employee populations, whether that be to Joy's point about how to best communicate, whether it be to Angela's point about how to make a program meet your needs and be compliant, whether it's around how to instill the greatest degree of safety and trust for employees returning to the workplace. And so I would just encourage everyone, don't do this alone. You know, I would encourage you to get help.
Mm-hmm.
Sterling here, we're happy to help, but whether it's Sterling or anyone else, I think the important thing is this is not something you need to do alone. This is not something you need to figure out alone. I think leveraging what others are doing, what's working, what's not doing, what's not working, and building off of that offers a lot of opportunity for companies to kind of get this more right as time goes on.
So my final thoughts are that this panel was absolutely amazing. The three of you guys provide so much great insight into this topic, not just today, but, you know, over the past couple of weeks and months, you've really articulated, you know, how Sterling is helping people at this time. You know, we're trying to keep people safe. We're trying to get people back into the office. And you guys have done a great job of explaining everything that we're doing. So thank you so much for joining me today. Thank you to our audience who's watching. We do go live every Tuesday at 1 p.m. Eastern across Facebook, LinkedIn, and YouTube. At any time, you can visit us across our social platforms. You can also visit us at sterlingcheck.com. Again, though, thank you, three of you, so much. I had a great time talking to you today.
Thanks for having me.
Thanks.
Of course. Thank you.